Hey guys, welcome back to the channel. So today we're going to be talking about electrolyte replacement for potassium, phosphorus, and magnesium. Now, something to note is that electrolyte ranges vary from site to site. They vary from lab to lab. So your reference range might be a little bit different. I just kind of picked a general range, and then I am using a electrolyte replacement protocol, but again, a little bit site specific. So there might be a few differences. So we're going to start with low potassium or hypokalemia. So the normal reference range for potassium is around 3.5 to 5.2 millimoles per liter. So you can start replacing potassium around 3.5, 3.6. That's okay. But you obviously don't want to give them too much at that point because it's not technically low. So the dosage here is around 10 to 20 millimoles per day. Then our next range is 3.0 to 3.4. And here we're going to give 40 millimoles per day. A general rule of thumb to follow with potassium is to give 10 millimoles for every 1 point you want your potassium level to raise. So for example, if we had a potassium level of 3.1, we would want to give about 40 millimoles to get it to 3.5. That's kind of a good rule of thumb. I mean, it does vary based on maybe the patient's kidney function or if they have a lot of losses, but that's a good guideline to start with or to follow if you're unsure. The other thing to remember is that in this range of 3.0 to 3.4, you might be thinking, well, 3.4 and you're going to give 40 millimoles. That seems like a lot, but not really. You would only really expect it to raise to about 3.8 because the reference range is pretty big, so you have a long way to go until you get kind of into the fives. Obviously, you don't want to overshoot it, but just kind of a reminder there, you do have quite a bit of a range. Okay, and then the next one is 2.0 to 2.9, and here you would give about 60 millimoles per day, and then you would want to recheck it because that's pretty low and dose again appropriately. So our replacement option, so we usually give potassium chloride. You can give this orally or through the IV. So through the IV, we typically have potassium chloride in 10 or 20 millimole vials, and they contain 2 millimoles of potassium per milliliter. So if you give this should be milliliters, a 10 milliliter vial, you're actually giving 20 millimoles. So just something to remember there. And the other thing is if you have a low potassium, you could also have a low magnesium. So low magnesium can induce low potassium. So if your potassium's low and maybe it's not replacing, it's always a good idea to check your magnesium. And also if both are low, you want to replace your magnesium first because a low magnesium will lead to kidney wasting of the potassium. So you're basically wasting your potassium if you give it first. So something to remember there. Okay, then we have phosphorus or low phos here. So a normal range is about 0.8 to 1.45 millimoles per liter. So if our range is 0.6 to 0.89, we want to give about 0.16 millimoles per kilogram. In this case, you could replace it orally. And we use something called phosphate Novartis, which come in 500 milligram tabs, and you might give it BID, and that contains about 16 millimoles of phos. It also contains about 3.1 millimoles of potassium and about 20 millimoles of sodium. If it's lower than that, you probably want to replace IV because enteral replacement might not do a lot for you. So If it's 0.4 to 0.59, we want to give 0.32 millimoles per kilogram. And then if it's less than 0.53, we want to give 0.64 millimoles per kilogram. So for IV replacement, we can use sodium phosphate. These are both IV. So sodium phosphate typically comes in 15 millimoles or 30 millimoles. We typically don't give more than 30 at one time. And then our potassium phosphate contains both potassium and phosphate. And it actually contains, so 5 milliliters of this is going to contain 15 millimoles of phos and 22 millimoles of potassium. So if you want to give 30 millimoles of phosphorus to replace it, you would want to give 10 milliliters of potassium phosphate, and that would give you 44 millimoles of potassium also. So you can do this. You can use this if your K is less than or equal to 4 millimoles per liter. So that's when you would use your potassium phosphate. If your potassium's high, you would want to use the sodium phosphate. Okay, and then we have low magnesium. So normal reference range is 0.7 to 1, and you can correct this if your albumin is low. So our reference ranges here are 0.66 to 0.73 and 0.41 to 0.66. So again, this is going to be a weight-based equation. So the first range here, we're going to give 0.05 grams per kilogram. And then the second range, we're going to give 0.10 grams per kilogram. We typically give it IV as magnesium sulfate. And we'll give this in 2 grams, 4 grams, or 6 grams usually. We don't want to give no more than 8 to 10 grams of this per day. You can replace it orally, and you can give it orally, but the only thing is, if let's say you gave a magnesium oxide, that can also induce diarrhea or have some GI upset with that. So that can actually result in more loss of magnesium. So it's usually better to replace it IV. And if you give it slower, you'll usually reduce kind of renal losses as well. And I forgot to mention, with the potassium chloride IV, we like to give this slow as well, because it can burn the veins, especially if you're giving it peripherally. So peripherally, we usually give it over 4 to 6 hours. And if we're giving it centrally, you can go a little bit faster. I believe it's around 2 to 4 hours. Yeah, so that's your electrolyte replacement for potassium, phos, and magnesium.